In medical news, research suggests that HIV is slowly becoming less aggressive. Dr. Philippa Cheetham is a urologist at Winthrop University Hospital and associate professor at Stony Brook University, and she's back here in our New York studios. Hey, it's good to see you.
Good to see you too.
So this is very interesting news. Explain this. How is this virus becoming less, and the word we would use is virulent, right?
Good word. Good word. So this research actually came out of my hometown. This came out of Oxford University, and they looked at blood samples from pregnant women in Africa. And it looks like, looking at the virus, how quickly it turns over, how quickly it replicates, it looks like it's becoming less aggressive. But what we must remember, Debbie, this is from Africa. These are African patients, and this may not necessarily be reflective of what's happening in America and also in Europe, because there are different types of HIV virus. But we are seeing evolution of the virus. And the first time we detected HIV in America was 1981, so over 30 years. We are seeing a change.
And is this typical of the behavior of a virus, that it can, mutate, evolve, as you say, so that it is less aggressive?
That's right, and actually that's what the virus wants to do, because if you kill the patient with the virus, that's the end of the virus. But if the virus has a way of adapting to survive in the host, the human being, then it can continue to be transmitted through different generations.
So very interesting and perhaps encouraging in the fight against HIV/AIDS.
Absolutely.
Let's move on to the next topic. There's research out here, and I feel like we've heard this a few times before. A Mediterranean diet is beneficial to one's health. In this case, it says it makes people look younger. How is this possible?
Well,
and where is it? No.
So Mediterranean diet tends to be very rich in fruit, vegetables, fish, not so much red meat, not so much saturated fats. And the kind of foods in a Mediterranean diet, fish as well, they contain a lot of antioxidants. And the antioxidants have been shown to reduce inflammation. If you reduce inflammation, it's good for your skin. It's also good to reduce the risk of developing cancer and heart disease.
Is this a matter of perhaps cherry picking a few things that might be typical of a Mediterranean diet, adding it to our own diet and getting the benefit, or do you really need to sort of do a wholesale change in how you eat?
At the end of the day, it's not a one-size-fits-all, but what we do know is cut down on red meat. The green leafy vegetables are very cancer protective. We know that tomatoes contain an ingredient called lycopene, which is prostate cancer protective as well as other cancers. So keep the sugars low, plenty of fruits and vegetables. It's kind of common sense.
It's that common sense. We want a magic pill, but it goes back to the eat right, exercise, get some sleep, and drink some water. That's what it all comes down to. Okay, let's get to our last topic, and this is a bit concerning. There's a study that shows that women that are dealing with mental illness are less frequently or not diagnosed soon enough with breast cancer. Tell us more about this.
So this study looked at screening for breast cancer from 24 publications in a journal. They were looking at nearly 700,000 women, and this study showed that women with mental illness are far less likely to get screened for breast cancer. And we know that in this particular study, 45,000 missed screening events happened in people with mental illness. And if you actually equate that to deaths, this was a UK study, and they showed that 90 deaths could have been prevented if those women had been screened.
Absolutely astounding. How is this possible? Is it because these people are not good at self-care, at managing their own health, or are they in institutions that are not helping them with managing their health?
I mean, I think there's a number of factors. Firstly, we know people with mental illness tend to be less likely to go to the doctor for preventative medicine. Also, they're not always checking for things like breast lumps. They're often on many medications. We also know that people with mental health issues have increased risk factors for developing cancers. They're more likely to smoke, they're more likely to drink. So I think it is multifactorial. But it is a huge concern, and I think the key message here for people with mental illness, the carers need to be aware to remember about preventative medicine, screening for prostate cancer, breast cancer in those people who are at risk.
Yes, because early detection is the key to living with it. All right, Dr. Philippa Cheetham, thank you so much. Good to see you.
Thank you.
See you again.